Welcome to our new presentation. Our selected topic for today is breast cancer treatment options. In this video, we have discussed about the different treatment options for breast cancer. In our previous videos, we have discussed about different types of cancer and breast cancer. Sign and symptoms of all types of cancer and breast cancer. Different stages and grades of breast cancer. Where and how breast cancer starts and spreads. The links of all those videos are in the description. You can watch those. Welcome once again to our nursing exercise channel. If this is your first time here, we have a YouTube channel that aims to enrich your knowledge about your health, fitness, medication, nutrition, diet, etc. And if it is your plan to update yourself about these important issues for all of the important tips, advice, discussion and presentation, make sure to subscribe to our channel and click on our notification bell icon. Let's start our presentation. How is breast cancer treated? Breast cancer is treated in several ways. It depends on the kind of breast cancer and how far it has spread. People with breast cancer often get more than one kind of treatment. Surgery. It is an operation where doctors cut out cancer tissue. There are different types of breast surgery, and it may be done for different reasons, depending on the situation. For example, surgery may be done to 1. Lumpectomy. It also known as conserving surgery, where the cancerous lump tumor is removed. 2. Mastectomy. A mastectomy is the removal of all the breast tissue, including the nipple. 3. Removing the lymph nodes, to find out if the breast cancer has spread to underarm, axillary, lymph nodes. One or more of these lymph nodes will be removed and looked at in the lab. This is an important part of figuring out the stage, extent of the cancer. 4. Reconstruction. Breast reconstruction is surgery to make a new breast shape that looks as much as possible like your other breast. Chemotherapy. Chemotherapy involves using anti-cancer, cytotoxic medicine to kill cancer cells. Most people get it after surgery to kill any cancer cells left behind. Doctors also prescribe it before surgery to make tumors smaller. These drugs are usually given directly into a vein through a needle or as a pill. 1. After surgery, adjuvant chemotherapy. Chemotherapy is given after surgery for primary breast cancer to reduce the risk of cancer coming back in the future. When used after surgery, it's known as adjuvant chemotherapy. It might be given to try to kill any cancer cells that might have been left behind or have spread but can't be seen, even on imaging tests. 2. Before surgery, neoadjuvant chemotherapy. Chemotherapy may be given before surgery to slow the growth of rapidly growing breast cancer or to shrink a larger breast cancer before surgery. 3. For advanced breast cancer or secondary breast cancer. Chemotherapy can be given to people with secondary breast cancer when breast cancer cells have spread to another part of the body. Chemotherapy can shrink or slow the growth of secondary breast cancer. Hormonal therapy. Some breast cancers are stimulated to grow by the hormones estrogen or progesterone, which are found naturally in body. These are known as hormone receptor positive cancers. Hormone therapy lowers the levels of estrogen or progesterone hormones in body or stops their effects. Hormone therapy for breast cancer can help to the followings. 1. Prevent cancer from coming back. 2. Decrease the risk of cancer developing in other breast tissue. 3. Slow or stop the growth of cancer that has spread. 4. Reduce the size of a tumor prior to surgery. Radiation therapy. Also called radiotherapy, uses high-energy rays to kill cancer cells. It affects cells only in the part of the body that is treated with the radiation. Breast cancer radiation therapy may be used to destroy any remaining mutated cells that remain in the breast or armpit area after surgery. There are two main kinds of radiation therapy that may be considered, and some people have both. 1. External beam breast cancer radiation. Traditional cancer-killing rays delivered by a large machine. 2. Internal breast cancer radiation. Newer treatments that inject radioactive cancer-killing treatments only in the affected area. Biological therapy or immunotherapy. Immunotherapy is the use of medicines to stimulate a person's own immune system to recognize and destroy cancer cells more effectively. Immunotherapy can be used to treat some types of breast cancer. Benefits of immunotherapy include the followings. 1. Stop cancer cells from spreading to other parts of the body. 2. Stop or slow cancer cell growth. 3. Be better at killing cancer cells. Targeted therapy. Targeted therapies are medicines that change the way cells work and help to stop cancer from growing and spreading. Not all types of breast cancer can be treated with targeted therapies. Currently, these targeted methods are commonly used in combination with traditional chemotherapy. For example, targeted therapy may block the action of an abnormal protein, such as HER2, that stimulates the growth of breast cancer cells. For example, trastuzumab, Herceptin, or lapatinib TYKERB may be given to a woman whose lab tests show that her breast tumor has too much HER2. Complementary therapy. Complementary therapies are therapies that may help improve physical and emotional well-being. Complementary therapies can help some women cope with their diagnosis and treatment, and provide a break from their regular treatment plan. They're given alongside conventional treatments and include the followings. 1. Breathing exercises for stress. 2. Massage. 3. Aromatherapy. 4. Acupuncture. Clinical trials. A clinical trial compares the effects of one treatment with another. It may involve patients, healthy people, or both. Clinical trials are research studies in which people agree to try new therapies under careful supervision in order to help doctors identify the best treatments with the fewest side effects. These studies help improve the overall standard of care. These are an important step in discovering new treatments for breast cancer and other diseases, as well as new ways to detect, diagnose, and reduce the risk of disease. Clinical trials show researchers what does and doesn't work in people. These also help researchers and doctors decide if the side effects of a new treatment are acceptable when weighed against the benefits offered by the new treatment. If you have any query, please comment in the comment box, and if you enjoy watching our videos, please subscribe our channel to receive notifications every time we upload a new video. Hit the bell icon twice. Thanks for watching.